Medical Dilemma.
Hello, everybody. Welcome again to the second segment of our show, Medical Dilemma. I have two special guests here. First of all, we have attorney Alice Rizos Vidal, who will now take the place of attorney Sarah, who, by the way, unfortunately cannot make it today. Then we have our special guest, a doctor from Sri Lanka, a pathologist, Dr. Nilo Abeyasinghe. Did I spell it right?
Yes.
Did I pronounce it right?
Right. Thank you for inviting
Thank
me.
you. Thank you for inviting us, Dr. Sanchez, to this medical dilemma. Now, to continue with our program, we're going to ask Dr. Nilo about his works as a forensic doctor in Sri Lanka. Can you kindly expound on that?
Yes, my practice has basically been in clinical and forensic autopsy work, where we examine victims of crime and then document and report to courts.
Now, do you have any methods or particular methods that you use in examining in examination?
Yes, we take a history first from, in the case of an autopsy, you may take a history from the relatives of the deceased person, and then you do the postmortem examination, take sample collection for, depending on what the history is, and then you come to conclusion about the cause of death and submit that to courts.
You mentioned about the sample collection. Are you the one going out and getting the sample yourself?
Yes, it depends. For example, in a homicide, if you go to a crime scene, you might have to collect evidence from the crime scene, and then when the body is brought for postmortem examination to the mortuary, again there are different samples depending on the situation which you might collect.
How about the methods that you use, like DNA, other methods that you use in order to identify a person?
Yes, in identification there are many methods used. What we call the primary identifiers are the fingerprints of a person, which are unique to that individual, DNA again, which is unique to that individual, and odontology. Those are usually the primary methods of identification. In addition to that, sometimes maybe because of lack of facilities, or maybe because you don't have samples with which to compare in some of those, you also use other supplementary methods which are not unique, but you can use visual, clothing, personal belongings, and medical evidence, like for example scars or tattoos, which are not unique things, but together collectively help towards identifying an individual. For example, in a mass disaster situation, that might be some of the key things. Just a unique tattoo might be the thing that helps to identify.
How about the teeth or the dentures? I think you can also identify a person through their dentures, is that
Yes,
right?
yes, it is possible. If they have, particularly if the dentist has a identifying marker on their work, then again you can trace it back through the dentist to identify the individual.
I read it somewhere that even the titanium plates used on the body, you can identify a person
Yes.
through that.
We had a sensational case years back wherein the identity of the person was only through that supposedly
Denture?
titanium dentures. But if it is a denture, can you be very specific that it belongs to that person, because the dentures are detachable, right?
Yeah, it is. That's what I said. If you have some identifying marker where you can trace through
Or they put their signature there or something
some
like
sort
that.
of
Sort of some,
where you can
yeah.
trace back to the records, but usually otherwise it is not possible.
Yes, I personally believe that it's while it can be used as an evidence, it is not very exact in the sense that you can fake your death. You can just put your your dentures there and then pretend that you have already died
Yeah,
or
on
got burned in an area or
yes,
something.
on a body, the unique identifiers are the fingerprints and the DNA evidence.
That's the more specific.
More specific
Yes.
identity.
Oh, that's good. Okay, any more?
Now, you mentioned about the DNA samples, and that is unique to a person. How can you expound on that? How unique is the DNA sample?
Yes, actually DNA is, you have two types in every individual. You have what you call the nuclear DNA and you have what you call mitochondrial DNA. So, the nuclear DNA is obtained, inherited from both parents, and therefore, it is a uniquely identifying type of DNA. You have, in addition, in the mitochondria of the cell, you have mitochondrial DNA, which is actually transmitted from the maternal side, so mother to child. So, that is not a unique identifier, but it can be useful in situations, for example, missing persons, so unidentified human remains. If there is some suggestion that somebody in a family is missing and then there is a maternal relative, I actually came across an example like that when I was in the UK, where there was a train crash disaster, and the only evidence they had of a person being killed was just a piece of muscle tissue. And since this individual's mother and grandmother had reported him missing, yes, they were able to identify him through this mitochondrial type of DNA, which is transmitted only from the maternal side. And likewise, you have the YSTR type of DNA, which is identified, it can be used both in sexual assaults and in paternity testing, which is a marker inherited from the paternal side.
So, in your country, how long is it for the DNA to come out, the results of the DNA? Was it long?
Well, I think it takes at least 6 weeks, if not more. It depends on a lot of factors, because laboratories, you know, staffing, and if some sample has to be sent abroad, sometimes it might take even longer. We do have the facilities, but still, say if you want a duplicate sample, so it
more or
takes
less
some
it's
time.
the same, no?
Yeah.
In
More or
the
less same
Philippines,
here in
yes,
the Philippines.
yes.
I don't have any idea. How about
Yeah.
do you think do you still need the consent of any relatives regarding the DNA sample that will be taken from a disease?
Well, usually in medical legal situations, it is actually the jurisdiction of the judiciary.
So you don't need any.
So in our practice, we normally don't obtain consent, but there are a lot of other ethical issues with DNA, particularly when it comes to making DNA data banks, and there are ethical issues about how much can you collect even from a
That's right. And how long can you
victim
keep the DNA sample?
Yes.
By
And
the way, we have to end and you know, present our
okay.
sponsors, and let's go to the third segment. I think they have some literature that they can show us.
Okay.
Thank you.
Thank you for inviting me, and I hope to see you again.
Yeah, okay. You're most welcome.
Okay.
Okay, let's go to our...
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
Why when you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?
Very intelligent.
Like there are other